Hello guys, now we shall be discussing about the second pair of cranial nerve, that is optic nerve. Okay, so our topic of discussion would be regarding the optic nerve. So what is your optic nerve? Optic nerve is nothing but your cranial nerve number 2. Okay, so that is your optic nerve. Now within this optic nerve you can see this entire structure which I have drawn over here. First of all, what is this structure? All of you have to understand few important things over here. What are those few important things are? See, this part over here is called as your optic nerve. So this is called as your right optic nerve. Right optic nerve, and this one over here is called as your left optic nerve. Left optic nerve. And where the optic nerves are joining together, this part is called as optic chiasma. Optic chiasma. Next, this part over here is called as your right optic tract. Right optic tract, and this one over here is your left optic tract. And down here you have got some bodies. These bodies are called as lateral geniculate bodies. Lateral geniculate body. Okay, lateral geniculate body. And remember one thing, from these geniculate bodies you have got such radiations. These radiations are called as optic radiations. And where are these optic radiations going? These optic radiations are all the way going to your visual cortex. This is your visual cortex. Where is your visual cortex present? Occipital. The occipital lobe is nothing but your visual cortex. Okay, so this is the occipital lobe of the visual cortex. Now here we have to discuss something called as field of vision. What do you mean by field of vision is that, for example, let us say if this is my eye. Okay, if this is my eye, when I am dividing my eye into two halves, this half can capture the images from the right side and this half can capture the images from the left side. In the same way, if I am dividing my left eye into two halves, this half can capture the images from the right side and this half can capture the images from the left side. Okay, or easy way to tell is that if I am dividing it into two halves, right, so this is called as a temporal half. In the temporal region, this is the temporal region, right? The temporal region, whatever images are there, that are captured by the temporal half of the eyeball, and this is the nasal half. The medial part is the nasal half, so the nasal images are captured. So that is what is called as your field of vision. For example, let us say this is the field of vision. To how far I can see is called as field of vision. For example, without turning my head, I can look at some things over on my left. I can look at some things over on my right. So this entire area is called as a field of vision. Now this field of vision can be divided into two parts. What are these two parts? In the center you have got your nose, right? So that is why this is called as a nasal half, nasal half. And what is this part called as a temporal half? This is your temporal, this is your temporal half. So we have got nasal half and temporal half. Next important thing is that here you have got a retina. Okay, in the eyeball, this is called as a temporal half of the retina. And here you have got a particular retina, and this particular retina is, okay, let me draw it with the red. See, this particular retina over here is called as a nasal half of the retina. Again, so this is the nasal half of the retina and this is your temporal half of the retina. Let me write it down. So this is the temporal half of retina. This is the temporal half of the retina. And after the temporal half of the retina, see, this part is called as a nasal half. Nasal half of retina. What I am trying to tell you over here is that, for example, let us say this is my left eyeball, this is my right eyeball. You see, this is my left, this is my right. Okay. Now, whatever images that are formed on the nasal half, right? You know what is nasal half now. Whatever images that are formed on the nasal half, all these images are taken up by what? They are taken up by the temporal half of the retina on the left side. Okay. In the same way, whatever images are formed by the temporal half, the temporal field of vision, are taken up by the nasal half of the retina here. In the same way here, all the images of the temporal half are taken up by the nasal half. all the images of the nasal half are taken up by the temporal half here. Clear? Now, after these images falling on the retina, so first of all let us discuss about this part of the retina, that is the temporal half of the retina. Once the images fall on the temporal half of the retina, you see a group of fibers that are running down from where? From the retina. From the retina, right, a group of fibers run down. This is called as optic nerve. So this optic nerve, these are the optic fibers. So these are the optic fibers that are coming from the nasal half or the temporal half, temporal half. Now these fibers, are they crossing to the opposite side or are they on the same side? You see, these group of fibers are on the same side. They are not crossing. Now, in the same way, if you look at the temporal half of the retina on the right side, here also you see the fibers are coming down. The fibers are coming down and they are ipsilateral. They are not crossing. They are not contralateral. They are ipsilateral. They are being on the same side. Now, what about these red color fibers? Once from the left eye temporal half and from the right eye temporal half, the images when they fall on the nasal part, what is happening? These group of optic fibers or the nerve fibers, they cross to the opposite side of the optic tract. Okay, you see they are crossing to the opposite side and they are going down. In the same way, it goes same with the right eye also. You see the nasal half here is crossing onto the opposite side. Now tell me, are the fibers, are both the temporal half of the fibers and the nasal half of the retina fibers, are they both crossing? No. Temporal half fibers are on the same side. That is why you call these temporal half of the fibers as ipsilateral fibers. Ipsilateral fibers. Ipsilateral fibers. Whereas these red color fibers over here are called as your contralateral fibers. Contralateral fibers. One is ipsilateral, another one is called as contralateral. Now, is there a complete decussation or partial decussation? So, in the optic chiasm, only 50% of the fibers are crossing, remaining 50%, the pink ones are on the same side. So, you call this decussation as partial decussation. Partial decussation or decussation. Okay, right. So, what is this body here? This is called as the lateral geniculate body. What I am telling you is that this lateral geniculate body is divided into 6 laminae. See here, this is 1 lamina, this is 2, this is 3, this is 4, right? I think I need to put the lines little bit with a less gap. 1, 2, 3, 4, 5 and 6. So again the same goes here. 1, 2, 3, 4, 5 and 6. So let us write it down. This is 1, 2, 3, 4, 5, 6. How many laminae? 6. 1, 2, 3, 4, 5, 6. So there are 6 lamina over here. Now what I am trying to tell you is that these ipsilateral fibers, whatever are there, okay, the ipsilateral fibers, these ipsilateral fibers, they enter into which laminae? They enter into lamina number 2, lamina number 3 and lamina number 5. See here, these ipsilateral fibers are entering into 2, they are entering into 3, they are entering into 5. Okay, whereas this contralateral fibers, they enter into lamina number 1, the remaining one, lamina number 4 and lamina number 6. Okay, the contralateral fibers enter into 1, 4 as well as 6, lamina number 1, 4 and 6. Okay, now this is the pathway of the optic nerve. Now what we shall do is that, we shall cut down this optic nerve at some locations. For example, what I am trying to tell you is that if I am cutting down the left optic nerve over here and I am writing it as A, this lesion is called as A. Let us say I am cutting down the optic chiasma here and I am telling this lesion is as B. Let us say I am cutting down this part and I am telling this lesion as C. Okay. So what will happen in A, B and C? The first important thing. Again, these are the vision and this is the nasal half and that is a temporal half. Okay. Nasal half of your vision and temporal half of your vision. So normally in you and me, the nasal half and temporal half will receive the equal inputs. So that is why it is absolutely normal. The patient will be absolutely normal. Okay, he can capture images from the medial half, from the lateral half, from the temporal half, from the nasal half also. Let us say this is situation number A, this is situation number B, this is case number C. In case number A, what is happening? The left optic tract is cut. If the left optic tract is cut, what is happening? Ipsilateral fibers, you see this pink color fibers. Okay, let me name it as 1. Okay, leave it. Just look at these fibers. These pink color fibers, you see these fibers which I am drawing right now, you see these pink color fibers are ipsilateral. So will they work? They won't work. If they are not working, they are receiving inputs from where? Where are they receiving inputs from? They are receiving inputs from the nasal half, right? So it means patient will have blindness over the nasal half. Okay, patient will have blindness over the nasal half. Let me write it down as nasal half and put it as patient having blindness over the nasal half. Next, this red color fiber is also cut down. When the red color fiber is cut down, what is happening? This fiber is going on to the opposite side. But whatever it is, this is receiving information from what? The temporal half, right? So what is happening? Even the temporal half is also gone. So nasal half and temporal half is also gone. Now is there any effect on the right optic tract or the right optic nerve? No. Right side at the level of optic nerve, they are receiving the information. So there is no problem, right? So this condition you call it as left enopia. Enopia on the left side, left sided enopia. Okay. Condition number B. In condition number B, only the red color fibers are cut down. The ipsilateral, the pink color fibers are normal. When the red color fibers are cut down, let us talk about this red color fiber. So on the left side, the red color fiber is receiving information from the temporal half. On the right side, the red color fibers is receiving information from the temporal half. So both the temporal halves are gone. Yes or no? So temporal half here and temporal half here is lost. So patient cannot see anything that is present in the periphery. He can only see the things that are present in the center. Okay. So this half will be completely be blind. So this condition you call it as bitemporal, because on both the sides, bitemporal hemianopia. Bitemporal hemianopia. Now let us look at condition number C. In condition number C, one pink fiber and one red fiber is cut. Now where is this pink fiber coming from? This pink fiber is coming from the same side from the nasal half, right? So same side nasal half is gone. Same side nasal half is gone. Okay. Next, where is this red color fiber coming? Red color fiber is coming from the opposite side from the temporal half. So opposite side from the temporal half is also gone. The nasal half of one side and the temporal half of other side is gone. So this condition, what kind of hemianopia you call it as? Right homonymous hemianopia. Right homonymous hemianopia. Right homonymous hemianopia. So these are some of the lesions which you need to know, right? So this is all you need to know about cranial nerve number 2, that is your optic nerve. Thank you so much for watching my video. Goodbye.